Welcome to Module 2 of the course on Health Economics and Health Policy. In this module, we'll shift focus from economic theories to the practical and political side of healthcare, health policy. You'll learn how health systems are organized, how reforms are made, and how public health challenges are tackled through strategic policies. Whether you're working in healthcare delivery, management, or policy advocacy, understanding how policy influences health outcomes is vital for making informed decisions. Let's begin with the basics of health policy. Headphone 1. Introduction to health policy. Health policy refers to the decisions, actions, and plans that are undertaken to achieve specific healthcare goals within a society. Policies can be made by governments, health authorities, insurance companies, or even large NGOs. These policies determine who gets healthcare, what services are provided, how healthcare is financed, what the priorities are, e.g., maternal health, cancer care, HIV prevention. Health policy has three major goals. Equity, making healthcare accessible to all, regardless of income or location. Efficiency, making sure resources are not wasted. Effectiveness, ensuring health interventions actually work and improve outcomes. Policies are shaped by scientific evidence, social values, economic capacity, political agendas. Policy development typically follows a cycle. Agenda setting, identifying a health problem. Policy formulation, designing solutions or interventions. Policy adoption, getting support and legal approval. Implementation, putting the policy into action. Evaluation, measuring the results and making adjustments. Understanding this cycle is important for anyone involved in health governance or service planning. Headphone 2. Health system financing and reforms. One of the most important aspects of health policy is how healthcare is financed. Every country chooses different models based on historical, economic, and cultural factors. Let's look at the three main financing mechanisms. 1. Tax-based financing, public systems. Used in countries like the UK and Sweden, where the government collects taxes and uses the money to fund healthcare for all citizens. Services are often free at the point of use. Advantages: high equity, universal access. Disadvantages: long waiting times, budget constraints. 2. Social health insurance, SHI. Seen in Germany, France, and Japan. Workers and employers contribute to a national health insurance pool. Healthcare providers are private or public, but reimbursement is standardized. Advantages: risk sharing, quality control through standardized packages. Disadvantages: complexity in administration, excludes informal workers. 3. Private health insurance. Common in the United States and parts of Africa. Individuals pay premiums to insurance companies, which cover certain health expenses. Often supplemented with out-of-pocket payments. Advantages: more choices, quick access. Disadvantages: high inequality, exclusion of poor populations. Health financing in developing countries. In low and middle-income countries, out-of-pocket spending still accounts for a significant portion of healthcare financing. This leads to catastrophic health expenditures, pushing families into poverty. As a response, reforms such as national health insurance schemes, community-based health insurance, public-private partnerships have been introduced to improve financial protection and access to care. Headphone 3. Equity, access, and efficiency. These three principles, equity, access, and efficiency, are the foundation of a fair and functional healthcare system. Equity. Equity means that everyone has a fair opportunity to attain their full health potential. It is not the same as equality. For instance, people in rural areas may require more healthcare support than urban residents due to poorer infrastructure. Barriers to equity: geographic distance, cultural beliefs, economic disparities, gender-based discrimination. Health policies must actively address these barriers by ensuring that marginalized populations receive additional support. Access. Access involves availability, affordability, acceptability, and accommodation. A person may live near a hospital, availability, but cannot afford care, affordability. Feels unwelcome due to language or religion, acceptability. Or cannot find time due to work hours, accommodation. Efficiency. Efficiency in health systems means achieving maximum health outcomes with the available resources. It's not just about cutting costs, it's about minimizing waste and maximizing impact. Health economists use tools like cost-effectiveness analysis and performance indicators to track how efficiently services are delivered. Policies must balance all three principles. Focus only on efficiency. You risk neglecting the poor. Focus only on access. You might create unsustainable systems. Focus only on equity. Services may be spread too thin to be effective. Headphone 4. Global health challenges and policy responses. We live in an increasingly connected world, and health problems in one region can quickly become global issues. Let's explore some contemporary global health challenges and the policy responses they demand. 1. Infectious diseases. COVID-19, HIV, AIDS, malaria, and tuberculosis remain major threats, especially in low-income countries. Global response involves vaccination programs, international aid, travel restrictions, disease surveillance. Policies should promote global cooperation, invest in public health infrastructure, and ensure equitable vaccine access. 2. Non-communicable diseases, NCDs. Diseases like diabetes, heart disease, and cancer now account for most global deaths. NCDs are linked to poor diet, physical inactivity, alcohol and tobacco use. Policy tools include taxing sugary drinks and cigarettes, promoting physical activity, strengthening primary care. 3. Health workforce crisis. Many countries face shortages of trained health workers. Policies must address medical education and retention, rural deployment incentives, task shifting to allow nurses and community health workers to take on expanded roles. 4. Climate change and health. Heat waves, pollution, floods, and droughts all impact public health. Policies must adapt to changing environments through disaster preparedness, clean energy policies, climate-resilient healthcare infrastructure. 5. Mental health. Often neglected, mental health is now recognized as a vital aspect of public health. Policies should integrate mental health into primary care, decriminalize mental illness, train providers and reduce stigma. Headphone 5. Evidence-based policymaking. Sound health policy depends on evidence, not ideology. Evidence-based policymaking means using research data, statistics, and scientific findings to guide decisions. This ensures policies are effective, resources are allocated wisely, interventions are sustainable. Sources of evidence include health surveys and censuses, randomized control trials, RCTs, health economic evaluations, disease burden studies, systematic reviews. However, there are challenges. Data might be incomplete or biased. Political agendas may override facts. Stakeholders may interpret evidence differently. Still, a strong policymaking process will involve all stakeholders. Review all available evidence. Test pilot programs before scaling up. An example is Universal Health Coverage, UHC, a policy framework supported by WHO. It aims to ensure that all individuals receive needed health services without financial hardship. Countries like Ghana, Thailand, and Rwanda have implemented evidence-based UHC reforms with great success. Headphone conclusion of Module 2. Let's summarize what we've covered in this final module. Health policy defines how care is delivered, financed, and evaluated within a system. Different countries use various financing models, public, insurance-based, or private. Policies must balance equity, access, and efficiency to be successful. Global health challenges, both old and new, require coordinated policy responses. Evidence-based policymaking ensures that decisions lead to real, measurable health improvements. Headphone final thoughts: health economics meets health policy. We've now completed both modules of this course. In Module 1, we explore the economic principles behind healthcare systems, how demand, supply, market failures, and cost-effectiveness influence healthcare decisions. In Module 2, we examine health policy, focusing on how financing models, reform strategies, global challenges, and evidence-based practices shape modern healthcare delivery. This knowledge empowers you to not only understand but also contribute meaningfully to healthcare planning, management, and advocacy.